Welcome back to Talk Therapy channel on YouTube. My name is Tammy Fletcher, licensed marriage and family therapist in California, and today we're going to be talking about how you can cope when your partner is dealing with mental illness. Conditions like bipolar disorder, depression, severe anxiety, PTSD don't discriminate. So what can you do when it's your spouse or partner who's struggling with mental illness? More importantly, how can you support them while keeping yourself together? Mental illness can have an overwhelming effect on a relationship. Whether or not the relationship can survive, in good part, depends on how you cope with your partner's illness. This video will give you some ideas on ways to manage. First, educate yourself about the illness. Learn everything you can about what it means, what your partner is experiencing, triggers, and treatments that are available. Knowledge is power, especially at a time when you may be feeling completely helpless. Learning about the illness will help you know what to expect and to become a part of your partner's treatment team. I'm going to put some links in the down bar below to help you get started. Number 2, recognize that you can't fix your partner's mental illness. You didn't cause it, you can't control it, and you can't cure it. Your partner is really the only one who can decide to go ahead with treatment and remain compliant. You can encourage and support your partner's decisions and their healthy behaviors, but ultimately it's up to them to make the decision to follow through with treatment. Third, avoid blaming your partner. Just as you wouldn't express anger or hostility if they were experiencing a physical illness, the person with a mental illness doesn't choose to be that way. But sometimes their behaviors can appear like laziness or lack of compliance or unreliability. It can be hard not to take those symptoms personally and feel blame or anger toward your partner. 4, feelings of frustration, sadness, even anger or grief are normal for you to experience right now. This may not be anything like the relationship you thought you would be having at this point. Your mental health is important too. So it's important for you to find someone that you trust in a safe environment where you can express your feelings, maybe a good friend or a trained counselor. Number 5, while taking care of your own mental health, it's important to also take care of yourself physically. You want to be sure that you're eating, sleeping, avoiding as much stress as you can, finding a balance in your life, seeing friends, participating in hobbies, all as much as you can. You won't have the energy or ability to help your partner if you are completely drained yourself. So self-care is very important right now. Second, there are some mental illnesses that can lead the person to, if they're in the midst of a crisis, to act out with verbal abuse or even physical abuse. So above all, it's important for you to keep yourself and any children, if they're involved, safe. And then number 6, finally, reach out to others who understand. There are support groups for those who are in a relationship with someone who's dealing with mental illness, both in-person support groups and on the internet. Sometimes just speaking with someone who's been there can be an enormous help. So don't let embarrassment or the stigma of mental illness prevent you from seeking the support that you need right now. Mental illness can be very difficult for couples and families to deal with. But remember that there is often effective treatment available for your spouse or partner and support for you as well. In every committed relationship, there are hurdles that the couple has to go through, and this is a big one. But there's always hope that treatment will be effective and that the two of you can face this hurdle together and even come out stronger on the other side. Not all couples are able to weather the storm of mental illness together. It can tear families apart, but there's always hope. It's always worth trying to see if symptoms can be managed and that you can make it through with an even stronger bond. Thank you so much for watching this video. I welcome your comments below, and I look forward to seeing you next time.